The federal Labor opposition and the Victorian Labor state government are running a campaign of lies regarding health funding across Australia, and in particular Victorian hospital funding. They are doing a disservice and harming my constituents in Frankston, and indeed, as the member said opposite, in Frankston. I am calling upon Labor to take responsibility for their lies and misinformation campaign, which is spreading a scare campaign for those working in healthcare in my electorate. It is certainly a reminder of their Medicare campaign at the last election, for which Labor still haven't apologised. And it wasn't true, it isn't true, and it will never be true. And that scared many of my constituents in Dunkley. But I stood up for them on this, and I will continue to stand up for them against the lies that are being spread by those opposite. Now, the Labor Party are the real party of cuts, because they like to talk about it so much. Cuts to health, cuts to Medicare, cuts to education, cuts for TAFE. They're all false, and none of these cuts are happening. They just love to use the word cuts to cover the fact that they are the real party of cuts in this country, reducing our standard of living. Whether it comes to taxing your housing, your retirement savings, your income, and so much more. The fact is that federal funding for public hospital services under the Coalition has increased from $13.3 billion in 2013-14 to a record $22.7 billion in 2020-21, a 70% increase. So that's about $10 billion more than when Labor were in government. How they frame that as a cut is beyond me. Locally, at Peninsula Health, in my electorate in Frankston, their funding in 2013-14 from the state was about $170 million, and from the federal government was $135 million. In 2016-17, state funding increased by about $24 million to $194.9 million, whereas federal funding increased by over $56 million to $191.6 million. So federal funding in Victorian hospitals, and including at Peninsula Health in my electorate, is more than double that of the state government. And this is despite responsibility for hospital management being primarily a responsibility of the state government. But it's not just about dollars, it's about the effectiveness of investment. Our funding is supporting more services, more doctors and more nurses in public hospitals. But Victoria has still not signed up to our new National Hospitals Agreement, despite the fact that it's been signed by WA, ACT, Northern Territory, South Australia, Tasmania and New South Wales. As far back as March, this was an issue. I issued a media release on the 1st of March and told the Dunkley public that the Andrews Labor government, including the state Labor member for Frankston, Paul Wedbrook, have shunned Victorians and are spreading lies. I would not put up with such falsities being fed to local residents as well as employees in the healthcare sector on the important issue of healthcare. Minister Hunt, the Minister for Health, an ardent supporter of health investment, especially on the Mornington Peninsula, and particularly given he was actually born at Frankston Hospital, pointed out in that media release that Commonwealth funding has increased much faster than Victorian state funding. Now, this new National Hospitals Agreement would provide Victorian public hospitals with an additional $7.4 billion, an increase of 29.6%. So Daniel Andrews is shortchanging Victorians. Not only this, we are at record levels of bulk billing. GP bulk billing rates increased from 82% to 85.8% since Labor's last year in government. And let's look at the 2016-17 financial year compared with Labor's last year in government. 21.6 million more bulk billed GP visits, 1.9 million more bulk billed specialist visits. A big part of the 2018-19 budget was about securing essential services, because we know how to run the economy, we know how to grow the economy. We are increasing revenue, meaning we can spend more on essential services, we can deliver tax relief, we can get back to a surplus, and we can pay more for healthcare. And indeed, that enables us to guarantee Medicare with an additional $4.8 billion over forward estimates. It means Spinraza, Kisqali, important things listed on the PBS to help local constituents in Dunkley.